So now moving on to the brain. The brain has many different parts to it. The cerebrum is the largest portion of the brain. The cerebrum has many convolutions. The gyri are the ridges, the sulci are the shallow grooves, and then the fissures are very deep grooves. The function of the convolutions are to increase the surface area of the brain. By increasing the surface area with all these folds, it allows the neurons that make up the brain to be able to form connections with more neurons, which allows more learning and more brain processes to be able to occur. So one wants a very convoluted, wrinkly brain. You would not want a smooth surfaced brain. The brain has different regions. There are white matter regions and gray matter regions. The white matter is characteristically lighter in color, and this would be deep in the brain. The white matter is made up of the myelinated axon fibers. And remember, the myelin sheath is a fat insulation, and so that's what gives the white matter its lighter color. The white matter is responsible for communication in various areas of the brain. The gray matter is the superficial cerebral cortex. So the outermost layer is going to be gray matter, and it is characteristically darker. Functions of gray matter would be sensation, communication, memory, understanding, and control of voluntary movements. On average, we have about 40% gray matter and about 60% white matter within the brain. The cerebrum is divided into two hemispheres by the longitudinal fissure. The corpus callosum is a large collection of white matter that's deep within the brain that allows connection between the hemispheres. The hemispheres are not equal in function. The hemispheres are contralateral, meaning that they control the opposite side of the body. So the left side of the brain is going to control the right side of the body. The right side of the brain is controlling the left side of the body. The hemispheres also exhibit lateralization, and this means that each hemisphere has unique abilities. The left hemisphere seems more responsible for language, math, and logic, while the right hemisphere appears more responsible for visual spatial skills, emotion, and artistic skills. Lateralization is a generalization. It's not that the left hemisphere only controls language, math, and logic. It's actually being done by all parts of the brain. It just seems that the left hemisphere may do a little more with that than the right, and then vice versa with the right and the left hemisphere. So this spinning test is often used in lateralization tests. And so you want to look at this and determine, is the girl spinning to the left or to the right? Technically, the image is not spinning at all. It's a two-dimensional image that's just shifting back and forth. But our brains try to interpret images, especially moving images, in terms of a three-dimensional world, since that's how we see the natural world. Our visual processing assumes that what we're looking at is a 3D image. And so in lateralization explanations, it's often said that if you see her spinning clockwise, you might be using more of the right side of your brain, where if you see her spinning counterclockwise, you may be using more of the left side of your brain. One thing you want to try is to see if you can actually get her to turn the opposite way for you. And a lot of times that works, like if you look at her and then you either close your eyes or look away and then look at her again, you might be able to get her to switch the direction that you think she's spinning. Here's another lateralization test. Can you find the face buried in the coffee beans? So again, this is a very general example. It is said that if you can find the man in 3 seconds, then the right half of your brain is better developed than most people. If you find the man between 3 seconds and a minute, then your right half of your brain is developed normally. And if you find the man between 1 and 3 minutes, then the right half of your brain is functioning slowly. Now, these sorts of tests, the spinning girl, the face, and the coffee beans, are very simplistic. And not only are the tests an oversimplification, lateralization in general is an oversimplification. Hemispheres can operate independently and have different abilities. However, the hemispheres are massively interconnected and work together, providing the corpus callosum is intact. The brain actually works as a whole. You're not only using the left side or only using the right side. And no one simple test can ever give a reliable measure of ability. You would need a battery of tests looking at a multitude of factors and looking for patterns of strengths and weaknesses, not one test and one test alone. A corpus callostomy is split brain surgery. This is when the corpus callosum is severed. This stops the spread of electrical storms that cause epileptic seizures. So, this sort of surgery is a last resort treatment for individuals with severe epilepsy and the seizures aren't being controlled by any other means. What they've seen is that this sort of split brain surgery can result in something called split brain syndrome. The left hemisphere gives orders that reflect rational goals, while the right hemisphere issues conflicting demands that reveal hidden desires. A couple of examples that have been documented. A patient pulled down his pants with his left hand and back up with the right in a continuing struggle. So the left hand wanted to do one thing, the right hand wanted to do another. A patient's left hand made an attempt to strike his wife as the right hand grabbed the left arm to stop it. So, especially immediately after surgery, it seems that there's a disconnect between what different parts of the body are doing because the brain has lost that ability to communicate with itself. This is a really interesting video to watch if you haven't already done so about severed corpus callosums and studies done on individuals who have had that surgery. A hemispherectomy is total or partial removal of a cerebral hemisphere. So, removing part or an entire hemisphere for whatever reason. Sometimes this is also done when epilepsy might be severe and actually causing damage to a part of the brain. Hemispherectomies, they have found that brains would be specialized in a normal individual have taken on additional responsibilities. So even though they've removed an entire hemisphere of the brain, the remaining hemisphere has seemed to learn what that lost hemisphere was able to do. So the brain is basically multitasking. This is due to neuroplasticity, the ability of the neural networks to change through growth and reorganization. This seems most effective in young children. Young children seem to have more plasticity within their brain, more ability for their brain to be able to take on new tasks. But recent studies are showing success in older individuals as long as they're getting adequate external stimuli, basically making sure they have enough physical and occupational therapy to help them in that new situation. If you haven't had a chance to watch these videos on this slide and the previous slide, take some time to watch them. They're very interesting to look at these individuals who have had this sort of surgery. So back to brain anatomy, the lobes of the hemispheres. There are 4 lobes in each hemisphere, and they're divided by sulci, and each lobe carries out a bulk of certain functions. Now remember that most brain functions rely on many different regions working together or in conjunction, and no functional area acts in isolation. So it's not like the frontal lobe is only working on its own and the temporal lobe is working on its own. Remember, behavior involves the entire cortex. There might be certain regions that are more responsible for certain things, but also remember that different areas can learn other tasks. So the frontal lobe is the front section of the brain. It functions in intellect, reasoning, motor skills, cognition, personality, and conscious. And it's closely linked to your limbic system, or the emotional part of your brain. Make sure that you take some time to look at this information about Phineas Gage. He was the foreman of a railway construction crew in the mid 1800s, and an explosion sent a metal rod through his head. It entered under his left cheek and completely exited through the top of his head. He was knocked over. There are conflicting reports of whether he lost consciousness or not, but the front part of the left side of his brain was destroyed. He was treated by a doctor and then sent home. He felt like he was good enough to resume work. However, his personality had changed drastically. And this was the first patient that had been extensively studied that there showed to be a link between personality and the function of the frontal lobe. So Phineas Gage and the studies done on him were really groundbreaking in the area of brain study. A lobotomy. This is a neurosurgical operation which severs connections in the prefrontal lobe. This was first performed in the United States in 1935. It became a mainstream of psychiatry for about 20 years until the mid 1950s. And it was used as a treatment for a range of mental disorders: schizophrenia, depression, bipolar, compulsive. There was opposition from doctors because they didn't think it was actually curing anything. But the popularity grew because basically at that point, doctors were desperate for ways to treat mental illness. And the conditions in mental hospitals were just horrible. And so doctors were looking for some way to try to treat patients and try to keep them out of these horrible mental hospitals. So a lobotomy is an umbrella term for a couple of different procedures. Trepanation is when there is a saw that cuts a hole in the skull, and then an injection of ethanol is inserted into that opening, and that starts to destroy different connections in the frontal lobe and other parts of the brain. Or instead of injecting the ethanol, a leucotome is inserted into the hole that the saw created, and it's swept back and forth and circular, and it basically destroys that brain tissue. A different type of procedure was the transorbital lobotomy, and this allowed access to the brain without having to saw a hole into the skull. And they access the brain through the eye socket. And they did this with an orbitoclast, which is very similar to an ice pick. It was inserted through the patient's eye. And then once it was inserted, it was moved side to side to separate the frontal lobe from the thalamus. So another lobe of the brain is the parietal lobe. This is the top middle section of the brain. It functions in the processing of tactile sensory information, such as pressure, touch, and pain, taste, and the judgment of texture, weight, size, and shape. The temporal lobe is the bottom side section of the brain, which functions as the primary auditory cortex. So, this is where the interpretation of sounds and language is mainly taking place. The temporal lobe also functions in smell as well as memories. And the last lobe, the occipital lobe, is the back section of the brain. And this serves as the primary visual cortex where visual stimuli is interpreted.